Okay, we're getting ready for the final exam and we will start on chapter 9. This is slightly different than what we've been talking because the chapter focuses on physical disorders and health psychology. I plan to emphasize more on psychological aspect of the problem than more from the physical elements because you can guess I'm not expert of physical diseases, but I can definitely tell there are some psychological components like stress and chronic stress and other neurological interaction that play major role in physical disorder. Right? So let's jump in. And how do we know there is something related to psychology in physical illnesses? If you look at the history of medicine, it is surprisingly good because the beginning of chapter talks about the leading causes of death was 100 close to 100 years back was influenza, pneumonia, diarrhea, tuberculosis, and other diseases like GI tract infection, and that was up to 40%. Now that 40% went down to 4%. Now let me write it because 40% to 4%, that's like a 90% improvement in our physical diseases in 100 years, right? That's great. Although we love to complain about the effectiveness of some of the disease in treatment, still we can see there are a lot of progress being made in medical science. Imagine Spanish flu versus COVID-19. Of course, the death rate for both cases exceeded 1 million globally. However, vaccine for COVID-19 came in a lightning speed. Within less than 1 year, the global medical system was able to start testing vaccine on humans. If you know the procedure for developing a vaccine, that takes years, at least approximately 6 to 8 years. This is ridiculously good news. Of course, there are still people who are skeptical about vaccine. Now, that is a major change we see in the past and the present. And we look at the behavioral medicine. Now, the name of the new field of study that reflects the shift in focus from infectious disease to psychological and behavioral factors that causes illness and death. It is not referring to a specific medicine, but the scientific way to prevent, diagnose, and treat. Right? Prevent, diagnose, and treat those medical problems. And for example, addiction, as we saw in a chapter before, that could be a very complex medical problem and so many factors associated with behavioral aspect. Using behavioral principle of learning, we understood from classical conditioning, we learned that stimulus is paired with a response, and operant conditioning, we learned that some of those behavior can be reinforced, and from social observational learning or social learning theory, we learned that behavior can be learned by modeling. So these theories, we see that we can try to address these complex issues with the proper application of reinforcement, punishment, and extinction, some modeling as well. So the ABC model allows to identify the underlying conditions of medical problems, changing A as an antecedent, C as in consequence. We identify what is the trigger, what is the cue that people choose certain behavior. And because of that behavior, what are some consequences? For example, stress, overworked mind, or boredom could be the antecedent to choose to use drug that could lead to temporary relief, feeling high, feeling good. All those could be the consequences. These consequences can reinforce drug using behavior. Now, we see that in diabetes, we see that in other heart-related cardiovascular disease, choosing certain food, choosing certain behavior like smoking is one of the major concern, and other problematic like not exercising, sedentary lifestyle, that could lead to a behavior that is problematic, that could lead to health problems. So ABC helps a lot to understand diabetes, and the book talks in a detail how HIV/AIDS could be related to this behavioral aspect in people. And when you say reinforcement, we try to identify the consequences that people are choosing and liking or disliking. The liking part could be the high, and the euphoria could be something that people like and that lead to increase the behavior frequency. And the other part could be stress or feeling that distraction from something that is bothering people. Oops, I lost it. That could reinforce the behavior again. So you see that. Now, when you talked about somatic symptoms and related disorder, people develop complex reaction to minor or no physical symptoms. This is purely due to psychological factors that give wrong impression about their well-being. In other field, we call psychosomatic symptoms. Now, using this word psychosomatic could be a it's a disorder with an obvious physical component. Now, it's misleading because it gives the impression that psychological disorders like anxiety and depression do not have biological component. That's not the case. Somewhat accurate term would be physiological somatic symptoms, right? Now, these help to understand, why we need to talk about psychology when we talk about physical illnesses. And if we are confident to integrate multiple approaches to physical and psychological problems, we know now that none of these disorders have single cause. Biopsychosocial, that's my favorite term. Biopsychosocial models or factors contribute to both mental and physical problems. Now, if you think, why someone with high stress but good social support seem to live well, there is like a high stress but good social support. When I say they live well, they remain healthy. Those high stress seem to be managed well. They continue to be happy. Their cognitive is very sharp, disregarding their age or even in the older age. And why some individuals, like elderly folks, decline in health when they are removed from their social network. That explains a little bit why do we need to talk about psychological aspect when you talk about physical health. The second revolution in public health, which is shifting from infectious disease to psychological factor, is happening slowly and steadily. That's where we see this behavioral medicine. And health psychology promotes and maintenance of health. That is a subfield of behavioral medicine health policy formation. And it tried to improve in healthcare system. Now, according to the principles of health psychology, we know that changing risky behaviors that can lead to disease acquisition will protect people, like in the protection against acquiring AIDS, protection against other like type 2 diabetes, protection against other cardiovascular disease. Another field that worth mentioning is positive psychology. That's a new field introduced by Eligman, who established this field, and the focus is not so much on diagnosis but on health aspect, well-being, what makes people happy, how to make life satisfaction, increase life satisfaction. And sometimes I wonder, what if we have a diagnosis called unhappiness disorder? Wouldn't that be fun, right? Unhappiness disorder in DSM-5, and there is a symptom criteria, lack of social support, lack of enjoyable activities. I don't know. Sometimes I wonder. We should have a diagnosis called unhappiness disorder. That would be fascinating to see. Okay, moving on. If you look at your table 9.1, it's fascinating. The leading cause of death chart in 100 years apart. Right? If you look at the disorders, like some disorder in 2010, not so long ago, some of those disorders from 1900 seem to persist, but not as bad as it used to be. Suicide was never in the list. Now it is there. Accident was never in the list. Oh, it was. But it seems like people still die with accidents a lot more. The cancer, stroke. Now, if you look at the cardiovascular disease, some of these diseases are preventable. Now, chronic low respiratory disease probably could be the infection that we're experiencing with COVID or any other. There's so many factors play a role. But this chart tells, how much things have shifted. And fairness to, people now, maybe because we have better assessment and diagnosis tools than in the past. However, we want to see in how many of these disorders are caused by psychological and social factors. That will be the focus in this lecture. Now, if you look at psychological and social factors that influence our well-being, the etiology and maintenance of medical disorder, we see that psychological factor influence biological process, behavioral pattern that increase our health problems. The examples are explained in the books, right? Genital herpes or HIV/AIDS, how behavior can contribute to develop these disease. Like choosing, right? There's some aspect that knowing about the disorder could be a problem. For example, AIDS is a disease of the immune system that is directly affected by stress. And when people engage in unprotected sex or sharing contaminated needles, and we know AIDS is still an incurable disease, but the best weapon in a larger scale is behavioral modification and prevent acquisition of disease. Why? If you know these diseases are caused by stress, why don't we try to attack the cause so we prevent developing disease? And it's not that people, people acquired HIV/AIDS and they die right away. That's not true. That's not the case. Actually, there is multiple aspects. For instance, like AIDS is directly affected by stress, and stress may then promote the deadly progression of the disease. And these two components tells us that how psychological factor is influencing the biological process. Acquiring the disease could be biological, but it will be developed if the psychological factor like stress is influencing the progression of disease. Now, people in HIV/AIDS, my understanding is they don't have immune system to fight external virus or any kind of virus. How many times we get sick? We constantly get flu. I mean, not flu, allergies. We constantly get cold, the headache, all of these minor pains and aches. That is treated with the white blood cells, right? When people acquire HIV/AIDS, they don't have this immune system to fight this disease. And when stress is involved, I don't know what happened. Stress is involved, I don't know what I did there. I like that, but when stress is involved, people seem to progress in these diseases much faster, right? And 50% of the leading cause of death in the United States are linked to behavioral lifestyle pattern. Bear in mind, all of these are preventable. 50%. Now, when I say 50%, that's half of it, right? Half of the leading cause, looking here, could be preventable. And it has to do with people's choice. And when you look at one of those behaviors, like smoking, is the leading preventable cause of death in the United States. Smoking has been estimated to cause about 20% of all death. Now, that's why smoking, right? I'm going to draw a cigarette. Smoking and poor eating habit. That could be, again, behavioral choices. Now, what to eat, and it's all on people. Lack of exercise, doing something to keep your heart, a little busy, and also burning some calories, keeping active so you don't get muscle atrophy. I don't think that happens without exercise, but it could. And obesity, so on. Insufficient injury control, failing to wear a seat belt could be one. Not wearing helmet when you're biking. Not taking precaution like using your phone while driving. That's, again, insufficient injury control. So a lot of acts, like if you see here, stroke, cancer, heart disease, accidents, diabetes, suicide, like you see that. I'm not sure about many others, but at least I know these are preventable disease based on lifestyle, behavioral choices, injury preventing controlled behaviors, and so on. Now that doesn't happen, and that leads to more and more problems. But what else is affecting? The number one cause of many psychological and physical disease is stress. Now when I say stress, I don't want you to stress about it. It's a, your physiological response of individual stressor. It could be your exam, and it could be your marriage, could be your relationship. And you will be surprised if you take a stress scale. There is an assessment tool. When you look at the items, I should post that for you just to give you a sense, how that affects. It's not always, sorry about that bike. It's not always that stress is negative. Sometimes it can be positive. Getting married, buying a house, having a kid, moving to a new state, moving out of your parents' house, that could be stressful. So there's so many factors that could lead to stress, not just negative or unpleasant experience. Positive experience could make you stressful. Getting a promotion in job, getting a new job, that could be stressful. Now, when you have stress, we have this endogenous resources to battle stress. The sympathetic nervous system mobilize our resources to protect our body from harm or danger. Now, there's this general adaptation syndrome talks about the theory of stress response. There's three phases, right? When you feel that alarm, this is where sympathetic nervous system is activated. It will send a signal to your brain there is something danger, and there's a chain of command. We'll see that in the physiological process of stress that leads to producing some cortisol hormone. It's a stress hormone. And in a good way, I like to look at stress as a protective factor because it leads to release some mechanism in our heart, because now heart needs to beat faster. And when it beats faster, the cells in our heart is dying faster. So this is helping. The cortisol level is helping you to repair some of those damaged tissues. But it's not going to do a long-term benefit because there's so many things besides repairing your heart. So the alarm system comes in, and there is a resistance attempt to cope with stress. It could be denying about it. It could be running away from the situation. It could be putting up with more work and effort. It could be it. But when it is long-term, when it is chronic, your body suffers from exhaustion. There is, overwhelming alarming system, and in long run, you become desensitized to those signals. Your body cannot manage it. And one very bad outcome of chronic stress is that your brain does not know when to shut down the stress signal. That's very dangerous. We'll see that in a minute. So stress is one big factor. But one thing I must mention here, there's a book about how to make your stress your friend, because when you are stressed, it is releasing not just cortisol. There is another hormone called cuddling hormone. It will come to me. That hormone is encouraging social connection. Social connection. Now, when you try to manage with our stress, the body tells us, go connect with someone. The cuddling hormone, it still doesn't come to my mind. So this social connection is encouraged to manage stress. I cannot emphasize enough how important is social connection and social network, whether it is in person or virtual, to manage our stress. And let's take a look at the physiological process. Now, whenever you are stressed, the activity of endocrine system is increased when we experience stress, and that comes through the HPA axis. This HPA axis is closely related to the limbic system, and hippocampus is close to the limbic system. I'm trying to give you the picture, right? When this hippocampus is close to limbic system, of course it will be affected. And what does hippocampus do? It controls emotional memory, learning, and memory, right? And also responsible of learning as well. That's what I meant, right? Emotional memory and learning. Now, hippocampus also help to turn off the stress response, sensing the danger of it. Why? Well, cortisol is dangerous for hippocampus. It kills nerve cells. And why it is not good? Well, when we learn that hippocampus is in charge of turning off the stress hormone, And if hippocampus is compromised, too much cortisol is present. And when there is too much cortisol, then that could lead to problem like problem solving, even dementia. In worst case, people could diagnose with PTSD and depression. Now, this neuromodulators, similar to neurotransmitter, flows along our bloodstream and reaches to our brain, passing blood-brain barrier. And one of them is a bad guy who comes from hippocampus and stimulates pituitary gland. And this activates the adrenal gland, then release cortisol, and this is stress hormone. It's the cycle. It continues to produce more stress hormone in our body, causing more damage than benefit. And of course, it will try to repair our heart, but it's not going to do long-term benefit. Now, what are some contributing factors to our stress? Well, from the study in Kenya, they found this social hierarchy in baboons. Now, when you think of these baboons, there's like a dominant group and there is a subordinate group, right? Dominant group has something in advantage, and I'll tell you the bottom line. They have this strength to control their life, and they have predictability and controllability of their life, and the perception of their life matters. But the subordinate group, they tend to have less prediction of their life. They have less control about their environment, and that means they don't have much control of their life itself, and that is affecting them to develop muscle atrophy, fertility, and cardiovascular disease, damage in hippocampus, impaired immune system. So these subordinate animals suffered from chronic stress. They were unable to turn off response because that the HPA system is less sensitive now, and they also showed less white blood cells. That's the weakness of the immune system. It makes sense, right? High level of stress decrease our immune function. And people, those who have poor immune system, high level of stress, even in young kids, if young children are getting sick very often without major exposure to, like rain or water or cold temperature or any other elements, it could be more than likely because of stress is affecting their immune system. And they catch cold and they feel more weaker, and that could lead to long-lasting damage. And early life stress can contribute to inflammation in adulthood. And we try to see that, some examples like rats given sugar water together with drug that suppress the immune system, and later this sugar water can alone suppress their immune system. Why? The drug that was causing some level of effect in their immune system is now paired with sugar water, and that could lead to develop more complex, physical ailment. Now, bottom line of this study is that how important to have predictability and controllability of our environment and our life. Now, when you have less control, you're more likely to develop depression, anxiety, and when you are more in control, there is excitement. Sense of control, the ability to predict what comes next, ability to cope with those stresses is so crucial. And that's why I think we emphasize so much on self-care. Taking a break from your activities, knowing your limit. It's nothing about your weakness or your being nice to yourself. Being gentle and compassionate to yourself is so crucial, because overwhelming work, testing your resilience could lead to exhaustion and, of course, long-term damage. Now, a little bit more on stress and immune system. Now, stress can affect immune function even if the stressful event lasts at least or as little as 2 hours. That's scary, right? So the emotional continuum, if you look at the image here, is that the how our emotion is changed based on stress, how we respond to those situations. Now, immune system, it identifies foreign materials or antigens and try to destroy them. And it could happen in two parts, humoral or cellular level. and that includes white blood cells, and there are B and T cells. You might have heard this quite often. I'm not so much interested in knowing all these numbers, but what matters is when you overly activate your immune system, when you are constantly stressed, what you're doing is now those immune system attack your own body cells. That's dangerous, right? That could be very harmful. In contrast to the early belief that the brain and immune system operate independently of each other, now we know that immune system functioning can be suppressed from classical conditioning. And there are many connections between the nervous system and the immune system. And there are psychological influence on the neurological response implicated in our immune response. And that's the example I gave here, right? The rats, those were given sugar water with drug to suppress their immune system. Later, this sugar water can suppress their immune system. Imagine you're taking over a lot, some kind of medicine or even stress. You're dealing with a lot of stress and you paired that with work. Now, stress is paired with work, and work alone can create more stressful response, and that could affect your immune system. Think of the classical conditioning. It could work in many forms. You associated, unhappiness with a person, and that association is so strong now, even without the problem around your life or presence of problem in your life, you might feel the same strong emotion toward that person, even there is no problem. That's because you're pairing, and that could affect your stress, and in the long run, it could affect your immune system. So, before I move on, let me ask you a question here. To emphasize a little more psychosocial factor and how that could lead to certain physical disease like AIDS and cancer. So if you look at the cause, how this psychological factor can progress AIDS, well, the symptoms may appear after many years of infection, and the minor symptoms such as weight loss and fever is eminent right away. But it may take as long as a decade to progress to full-blown AIDS, appearance of serious illness. In developing, world, that you see that most people die within 1 year of AIDS. But if you look at the other factors that contribute to developing this psychological factor that impact AIDS, is high stress and low social support. Now, both of them, as we saw in the anatomy or the physiology of stress, how stress influence hippocampus to become less sensitive or not so effective to turn off the stress signal. And both of them are connected with social support. If somebody is living in a household that is constant conflict, many psychopathology in family members, drug use, crime rate, those factors play a role. And in terms of cancer, you see that psychological factor can also impact cancer risk by impacting functions such as immune system and viral activity, DNA repair progress, and gene expression. Recall the diathesis stress model. We saw that when certain genes are inherited in people, but those genes do not turn on until a certain stress factor is present. When social support is lacking and when they are not adequate for those individuals, they may progress in those diseases faster. So there's much to talk about psychological aspect in there. And the goal is, of course, trying to manage stress. Now, the outcome of this change in lifestyle, reducing stress and boosting immune system, could lead to increased T helper cells and lower antibodies, enhanced psychological adjustment, because again, people with proper social support, and I might have mentioned about this study from the Oxford University. They conducted this 75 years long research on humans, what make them happy and what make their life successful. And after 75 years later, they found it's the social support, social connection that make people's life meaningful and successful. So when you look at different diseases, AIDS or cancer or diabetes, any of this physical ailment, we cannot, emphasize enough how important is social support and sense of control and predictability of our life. And same thing is true with the cancer. I think that's what we just mentioned. We're trying to improve those individuals by choosing healthy habits and encouraging treatment adherence and endocrine function, which means we're also trying to help them not to have this constant cortisol level floating in their bloodstream, which affects their well-being, stress response and coping mechanism. And that is having a proper technique to deal with stress. How many times that you have paused in your day to take a deep breath and sort of relax. That's not common, because I know, especially in my classes, not just this 3390, but many classes, I know that students are taking 4 to 5 and sometimes 6 classes in one semester. That's a lot. And this is overwhelmingly taxing on your body, your well-being. So taking some type of measures to reduce stress could be listening to music, go for a walk, riding a bike, talking to somebody, watching a show, just looking at your garden. Sometimes, just doing nothing could be so powerful. And I, being a long-term mindfulness practitioner, know that this mindfulness practice can be beneficial. And I need to look into research, but they have found some of physiological changes. Like one fascinating research, they found that people, those who meditate a lot, they are able to control their body temperature. Like Tibetan monks, they did study on those individuals who are lifelong meditators, and that is not controlled by our mind, but they were able to change that. Imagine you develop this skill of mindfulness or relaxation technique that could change your physiological reaction, your neural connection. The endogenous endorphin, right? That heals our pain, that repairs some of the damages. That would be fascinating. And some psychological factor that could affect our physical disease, like cardiovascular problems, unhealthy or risky behaviors that impact directly on the cardiovascular system, that could contribute to strokes, high blood pressure, and coronary heart disease. Now, when you look at individuals who went through laboratory stress tests, they found that they tend to have greater reactivity in their blood pressure when they compared, like various psychological factor has been used to explain in their life, and they show that blood pressure is changed based on their coping style, personality type, and also level of stress. And those with normal blood pressure, whose parents had high blood pressure, changes their behavior, lifestyle, and attitude, and they can prevent their heart attacks. So when you look at this laboratory stress test, you notice that people tend to show change, how they manage their problems. And chronic stress is manageable. That's what I was talking about at the beginning. Stress is manageable. They are preventable problems that could affect your well-being. And hypertension is another risk factor. It's a high blood pressure that could increase heart disease, kidney disease, and attacks on the blood vessel. So the cause, it's pretty prevalent. If you take 4 people, one of them among 35 to 60-year-old has this hypertension. And the risk is, of course, some behavioral aspect and some physiological aspect. Excessive sodium intake, sympathetic arousal, that means frequently they are in fight, flight, freeze mode. Stress level, in constantly dealing with too much responsibilities, too much work, not doing anything to self-care. Excessive anger, there's definitely emotion problem, and hostility. Some psychological factors such as personality, coping style, and again, level of stress have been used to explain individual difference in their blood pressure. Social support plays, again, important role to cardiovascular disease. Loneliness, depression, feeling of uncontrollability are some of those psychological factors that contribute to cardiovascular disease. And again, on the protective side, we have happiness and optimism that is associated with heart health. And some other diseases like coronary heart disease, blockage of arteries supplying blood to the heart muscle. Some psychological factor, I might sound redundant here. There's a stress, anxiety, anger, poor coping skill, right? There's impatience going on, excessive drive and competition is going on, and this is more evident in people who is identified as type A personality pattern. They tend to be more angry, excessive drive and competition, impatience, accelerated speech, agitated motor activity, and that could lead to a negative effect. Sometimes it could be due to low socioeconomic status, and it could be stressful experience in life. Going through some like the living in an environment or neighborhood that is high in crime, and poverty could be one problem. Low social support. Now we're trying to identify, even these are physical disease, what other factors like psychological factor play a role. Now this interaction of risk factor shows that how people develop risk of CHD, right? If you look at the low economic status, access to resource, position in social hierarchy. Remember we're talking about baboon in Kenya. When you are in subordinate or you don't know what's going to happen next, those who are living in constant threat to their well-being, could be internal threat like the family members, or external like the law and reinforcement. We see that news how these minority are experiencing high stress in different region because of the crime, because of sometimes it could be systematic racism, right? That could lead to, and no wonder the rate for some of these hypertension and the related problem is high in African American individuals because of some of those political factors. And the threat of actual or potential danger is constantly triggered. The sympathetic nervous system is activated, and it could be affected by tangible interpersonal or intrapersonal aspect, and that lead to negative emotion and cognition. Now, if you have negative emotion and cognition, it is not all false, right? Sometimes people, let's say, experience a lot of discrimination and mistreatment in their early life. Now, that memory affects how they perceive current situation, and that could lead to developing CHD. And if you have positive emotion, maybe it might not be that bad, because now it's somewhat manageable and something that's controllable. So the point here is we're trying to identify what are some psychological aspects that lead to physical ailment, especially CHD. Another physical ailment that could affect our well-being and also can be affected by psychological factor is pain. Now, pain is not a disorder, but it's an expensive sensation that costs billions of dollars to over 100 million people in the United States alone. Now, if you do that estimate for the rest of the world, now 100 million is about 1/3 of the nation's population. Oh, there's like a lot of zero in my narration. So when you compare this number to the world population, you can imagine like 1/3 of the world population could be worse in the world population figure, suffer from acute or chronic pain. Now, when you say acute, it could be something that is immediately experienced, right? And pain may be associated with both measure of fatigue and measure of illness belief. So it's physical and also psychological. And what is chronic? Now, acute could be immediate. You feel that pain and you react to that pain, and it may eventually subside. Chronic pain is more prolonging, right? And this prolonged feeling that does not easily go away could be affected by psychological and social factor For example, low perceived control, your perception of controlling the pain, your negative emotion associated with pain, poor coping skills, not using effective approach or effective measures to prevent, and low social support, right? Those are possible reasons, possible factors, I wouldn't call reasons, that is affect psychological factors that could affect chronic pain. We feel pain when our tissues are degenerating or growing of cancerous tumors. So pain happens when something goes wrong in our body. And of course, when we don't feel pain all the time, if we don't feel pain at all, that's dangerous. But sometimes we don't notice it until to the point that your body sends a signal, hey, there is something wrong, you have to do something. So that changes our behavior. And sometimes it could lead to like certain pain behaviors like limping, complaining, or avoiding certain activities could be like, behavioral change. And sometimes it could be compensation. You find ways to cope with your pain by taking day off, paid time off, so on. And sometimes you seek sympathy from individuals that you're around. So pain is pretty prevalent and it can be dealt with many ways. Now, it reminds me of a Buddhist principle related to pain. Not actually physical pain, but suffering part. And, this the dissatisfaction with how you feel. Now, pain leads to this suffering part. And, the important of this idea is that how you perceive pain matters. People, those who have positive sense of control and have optimistic outlook about the future, they experience less distress and disabilities. So what does that mean? Well, they try to cope and do things to change their course of life, seek help, less focus on pain. But individuals, those who have totally opposite of what I just mentioned, which is negative sense of control or pessimistic outlook about the future that they experience, they are more likely to experience distress and disabilities. And to me, that's like a psychological suffering, right? The pain is, sometimes it's manageable and sometimes we just need to change how you perceive. For example, chronic pain, we talk here, like some mechanisms is like, you clinging to that pain is a problem because you constantly see that you are the victim of this pain. And the gate control theory of pain talks about neurological process, anxiety, fear, intense control about your physical sensation can affect to the degree which pain is detected. And if you're too anxious, too concerned, too focused on those sensations, maybe that could lead to more sensation, more awareness about pain. In regard to the gate control theory, they found in some neurological factors like small fibers are thought to open the gates, allowing pain sensation to be transmitted. Now, if you remember, we talked about opioid. There we saw that there are some neurotransmitters in the spinal cord and some in the brain, and that's where you receive the pain signal, right? You receive the pain signal, and when you receive the pain signal, you're more than likely to send your endogenous pain killing mechanism, right? So we do have built-in system to take care of those pain, but again, how do you perceive that and how do you see that matters. Now, what influenced this sending signal, the gate and the blocking sensation of the pain? Well, that's like how you perceive the pain. Strong negative emotion, that means strong message to the brain. Positive emotion, that means more inhibition that takes us to control the pain message that's sent through the spinal cord and through the brain, and blocking those mechanisms. So that leads us to talk about endogenous morphine or endorphin. That's the natural pain inhibiting neurochemicals that we have, which can be increased, which we can actually enhance this. I'm trying to turn my pen on. Enhance by exercising. Now, if you remember eating something spicy, you may have felt that pain is blocked in a few minutes. And if you're running for 10-15 minutes, whatever fatigue that you experience is not anymore. When the players are running and they are injured, they continue to play. Why is that? Well, there is this pain blocking mechanism activated in our body without any external chemicals. And the other fascinating thing is that, high self-efficacy, more endorphin, and high tolerance for pain. So I'm talking about psychological factor, how that affects your pain sensation. Acupuncture, another example to talk about pain. When you engage in acupuncture, you're constantly stimulating pain sensation, and your brain is able to block those signals. That's how endorphin is released to those areas, and acupuncture works. Eating spicy food, doing exercise, running, these activities can activate this endorphin system. Now, the other important difference between male and female is that females have additional pain regulating mechanism that may have involved with for female to facilitate childbirth, and also extra pain regulating pathway focused on relieving pain associated with the reproductive system. Now, this difference between male and female may benefit from different kinds of medication, of course, but the other important part I want to add, how pain can be influenced by psychological aspect, is placebo, right? Placebo effect. If you remember any experiment talking about, your expectations and appraisals, sometimes people get sugar pill and they're told it has medication. And guess what? That belief allows to release endorphin to release pain. Isn't that fascinating? Right? So those are some ways to look at how pain affects and how pain can be influenced by our mere thinking. Now, some other therapeutic approach like psychosocial treatment for physical disorders, of course we cannot deny about these new approaches like meditation and relaxation techniques. And although this improvement is also moderate, some relaxation techniques have been shown to have a positive effect on headaches, hypertension, and pain, right? If somebody has been diagnosed with cancer and the person's initial response would be denying that there is a serious condition, right? That the person is using this defense mechanism, right? We're denying it. We can't cope with it. I don't have this problem. But eventually, those individuals are likely to develop better coping mechanism. And denying about the serious illness of physical conditions can be helpful. Why? Again, you're trying to block the sensation. It will help people to, especially in the early stages, and later, it is important that those individuals seek proper help, because it allows them to not just the physical but also psychological aspect to manage. Now, progressive muscle relaxation, I will share that link. I think I did already. For the self-care day, I shared that link. It is a progressive muscle relaxation where you practice tensing your muscles, starting from your hands or from the top of your head. That's what I do when I practice, when I demonstrate. So you tense your muscles and feel the sensation and notice those sensations, and you relax. So you're trying to rechannel how you perceive pain, because pain, again, there's a Buddhist saying, pain is preventable, suffering is pain is inevitable, but suffering is preventable. So when you say pain is preventable, because physical pain is interpreted as not good by our mind. And if you can train your mind not to take those pain, and when you talk about mindfulness, we go in a lot more detail, you see that you're teaching individuals to be aware of their sensation without identifying with them. That's a big piece. And some other intervention like transcendental meditation, focusing attention on a repeated mantra, that's like a more concentration meditation. You take an object, you take a sound, or you take a light, something like a signal light, and you focus on that, and you try to keep your attention on that particular object for a long time. What happens is, anytime you feel sensation in your body, it's related to chronic pain or any other type of pain, you need to interpret, right? You need to direct your attention to that particular spot in the body. And if you train your mind not to observe those sensations and cling and hold on to them, you're more than likely to experience less of that. And some other approaches that you might have heard is like monitoring your daily stressful events. Like, when do you need these approaches? And when I talk about mindfulness approach, whether it is cognitive behavior therapy related or just in general, it is a skill. It's like you're training yourself, right? When you try to, for example, cope with chronic pain or chronic fatigue syndrome or hypertension, and you definitely need more than one approach. And teaching a coping skill like mindfulness could be helpful, because in mindfulness you try to observe your present moment sensation without liking or disliking those sensations, and staying in the present moment, because pain can be associated with the future goals. And if you start to see that you are unable to do things, like in individuals like fibromyalgia, you may be suffering more than other individuals. But this takes to talk about your management aspect, stress management, which is more effective than just biological or relaxation technique alone. Your biofeedback or relaxation technique alone. And CBT, they talk about stress management program to help clients to learn about developing more realistic appraisals and attitudes. Let's say somebody has chronic pain. Now, when I say chronic, it's not going to go away. Now, they have to live with it. There's a beautiful therapeutic technique called acceptance and commitment therapy. They tell them to find meanings in their life. Now, if you have chronic pain, it's not going to go away until you die. You don't want to give up all the important things that you do in your life. So find the meaning in your life. And despite these adversities that you experience, how could you make your life meaningful? That's one approach, right? Cognitive behavior therapy tries similar. They try to challenge what are some realistic and unrealistic attitudes that you have or perception you have about yourself, and identify unrealistic negative thoughts. You will never be happy could be very strong negative statement, because you might have enjoyed times with those physical ailment, and cognitive behavior therapy will try to find evidence for and against your negative thoughts and try to help you and assert themselves in appropriate way in stressful situations, rather than always giving in or taking a lot. I think I heard of a classmate, a colleague who had a major neck injury and continued to take on a lot of responsibilities. And when I talked to her, she did share that she need to assert when it is appropriate and when there is a stressful life. And she also shared that when she didn't assert, it ended up adding more stress in her life. It comes down to how to look at these ideas, realistic appraisal, unrealistic negative thoughts, and asserting yourself. And besides that, there's so many other ways to manage your stress. And as students, I know all of my students do take a lot of stress in everyday life. They need some level of training, and I hope there are trainings that is given to students to manage their time. Taking 6 classes or 5 classes a semester, plus full-time job, and plus children, that is a lot of stress, right? That's a lot of stress, and stress alone could be a very strong factor to develop physical and psychological problems. And when you try to address them, time management, asserting when it's necessary, and assertiveness training comes in behavioral therapy technique. We try to tell them, identify what is your right and what are other people's right. So you need to find the fine line. So you're not being aggressive, not being passive, but standing out for what you deserve. So these could be possible way to manage some of those psychological factors that is affecting physical well-being. Let me ask you a question now.